Autism spectrum disorder, or ASD, is a broad neurodevelopmental disorder which includes disorders such as autism, Asperger's, and Rett syndrome. Liu et al. 2016 outlined ASD to carry persistent characteristics including repetitive behaviours, interests and/or activities, and a lack of social interactions and communications. These characteristics, often affecting each diagnosis, dramatically different. While some ASD students are incredibly intelligent and referred to as gifted, some are without the brain development of the typical student and can often be intellectually impaired. So what does this mean for Australian classrooms and teachers? According to the Australian Bureau of Statistics, in 2018, 205,200 Australians had an ASD diagnosis. This is a 25.1% increase from 2015. Of which they found the most predominant years of ASD is between 5 and 14. In 2018, the ABS reported of the 106,600 people with ASD between the ages of 5 and 20, 59.7% reported difficulties with fitting in socially, 55.3% had learning difficulties, and 51.5% had difficulties with communication. This all leading to few, 8.1%, autistic students going on to obtain education past school level and often being subject to bullying. Studies such as Liu et al. 2016 and Tarash et al. 2020 point out the timeliest area for intervention and acknowledgement of ASD are in the years where students attend preschool. As the knowledge and diagnosis of ASD increases across Australia, teachers and parents are faced with many complications when including ASD students in mainstream classrooms. Some of these teacher complications include initial lack of self-efficacy, teaching strategies and curriculum adjustment, communication with the student due to language barriers and the student's interactions with peers, and issues involved with regular behaviours surrounding the student with ASD. For most people sending their child or children to school, there is an expectancy that teachers are adequately trained to support and guide all students to their maximum potential as a learner. However, with the current training available, teachers lack the knowledge and skills to scaffold ASD students, bringing you to the question, what training is available? In 2017, Coates et al. Completed a study on available pre-service teacher and teacher aid courses in Queensland, Australia. The study found 45 programs containing 295 courses within 10 universities, of which 51 were courses that were based on inclusion or disabilities, and only one course was offered for ASD specifically. Of the 8 institutions, the authors found 8 programs containing 158 courses, where 17 of those courses were based on inclusion and disability, and there was 0 to offer for ASD specifically. When you consider the rate of ASD students in mainstream classrooms and the complexity of this disorder, these numbers are alarming. However, with studies such as Bond et al. Bringing attention to Simpson et al., who argues that identifying focused interventions to implement in specialist ASD educated training can be controversial due to the lack of guidance in converting these skills into practice. Bond et al. 2017 also outlined key elements such as a significant person like an educational psychologist across the school, in assisting with awareness, support, and establishing a culturally inviting school, while emphasising on the need for ongoing staff training. Through additional training, supporting professionals such as educational psychologists, and embracing school environment and outside organisations, teachers can build their knowledge, skills, self-efficacy, and empathy towards students with ASD in their classroom. This in turn can assist teachers to develop individual strategies for communication, as well as educational and behavioural strategies to guide ASD students in obtaining appropriate educational opportunities, while allowing them to feel welcome and accepted in the classroom and school environment.